Are you frustrated by weight gain? Is it getting in the way of your best life? Listen and watch as weight loss surgeon Dr. Anthony Gonzalez breaks down the obesity epidemic. Would you say that the mindset has shifted when it comes to obesity, whereas before maybe it was a little more dismissed, whereas now it's actually seen as a disease?
Yes, no doubt about it. Obesity is seen as a disease. Doctors are recognizing that if they want to treat the patient's high blood pressure, high cholesterol, and diabetes, that is all linked to obesity.
Right.
And if they can take care of the obesity, those medical problems would go away. So we're learning that treating the obesity may help the other medical problems as well.
Another thing that's tied to being overweight or just having a healthy weight, we hear those three little words a lot, BMI. So what is BMI and how does it relate to a healthy weight?
Well, there's a lot of ways to measure obesity, but the simple way that anybody could do at their house is check their body mass index. Their body mass index is their weight in kilos over their height in meters squared. But I know nobody weighs in kilos and nobody measures in meters here in the US. But you can plug that in on any little iPhone app, any online calculator.
Do the conversions.
Do the conversions. You put in your height at 5'2", you put in your weight at 250 pounds, and it'll spit out a number. And as you can see by the graphic, if your BMI is 30 or greater, that's considered obese. 35 to 39 is considered severely obese. And then 40 or greater, which is the area we're talking about today with surgery, is morbidly obese.
But we're so concerned with getting on that scale and looking at our weight, the actual number, but really what we should be focusing on is BMI. Is this correct?
That's correct. Your BMI will apply to the grand majority of people. Who doesn't it apply to? I always tell people it doesn't apply to that bodybuilder Arnold Schwarzenegger figure. Why? Because he weighs 250 pounds, but it's all muscle mass.
Right.
But for the everyday person, the BMI will be applicable.
This is something interesting. You and I were kind of going over it camera. People measure their weight to your waist to torso.
Yeah, so obesity is distributed in two different forms.
Okay.
Your obesity could be more central obesity, which is around the mid waist and gut area, and then your obesity can be more hip oriented. So what we say is if you are shaped like an apple, which is central obesity, that leads to more metabolic issues. It leads to more diabetes, to more high cholesterol, and those two lead to heart disease. If your obesity is more pear-shaped and your obesity is more around the hips and you look like a pear, then the obesity is a safer type of obesity.
Okay.
Of course,
neither is good. No obesity is good
but
obesity.
we do know that the distribution of that fat leads to more medical issues.
And we often talk about the abdominal fat as well, which is also kind of a red flag indicator that there's something going on health-wise.
Yes, correct. So that's more of that central obesity. That's that apple-shaped pear patient. That's the patient who has metabolic syndrome, if you have heard of. Metabolic syndrome is that central obesity, high cholesterol, diabetes, and that leads to the medical issues much sooner. That is more of what we call almost a malignant obesity, where that obesity is very, very dangerous.
Thank you for clarifying that, Doctor. Now, I'd like to take a moment to let our viewers know that if you have a question for Dr. Gonzalez this hour, you can call in using the toll-free number 855-796-4475. Now, there are a number of different reasons why people may be overweight or obese. So we briefly mentioned lifestyle. Would you say that's the main factor?
Yeah, I think that's the main factor because that's really the only factor that we can control. Our lifestyle, what we eat, what we drink, exercise, things like that is the only thing that we can really control. Now, of course, there's genetics and there's hormonal issues and there's the thyroid. There's other issues as well. Socioeconomic factors can and cannot be sometimes controlled. And then certain medications. There's no doubt somebody who ends up with a condition that requires steroids, prednisone, can increase their appetite, increase their water weight, and increase their obesity. So medications can cause. But for the grand majority of people, it's going to be your lifestyle. It's what you eat, what you drink, and the amount of exercise you put in every day.
So how much do genetics play a part? Because you often hear, oh, I was just built like this, or I have, the same genes as my dad. And so I wouldn't say blame, but it's sort of taken to family.
Yes, there's no doubt. Genetics plays a part. There's no doubt that you can't beat the genes, but the genes of obesity itself can be controlled with lifestyle issues. So despite that you may have had obesity in your family, your parents were obese and so forth, you can control that with your lifestyle changes. You may have to put a little more work in, and I always give the example of the youngster who is diagnosed with diabetes at a 6-year-old age.
Right.
They have to change their lifestyle because of that condition. condition. And I tell my patients, you have to think about obesity as a disease. You have to change your lifestyle. You have to prepare your food. You have to exercise. You have to do things just like a diabetic would do things differently.
Well, I have a bone to pick with metabolism here a second, because why is it that as we age, we're more likely to put on more weight and it's a lot harder to put it off? Why?
Well, we don't completely understand why that happens. There's a couple things about metabolism we don't understand. Number one, every day your metabolism slows down. So theoretically, if you were to follow that, every day you should eat less than you ate the day before. And by the time you're 60 or 70 years old, you should be eating like a bird, literally, okay? The second thing you have to understand is that when you go on a diet and lose weight, your metabolism slows down.
Right.
Why? Because the body does not know that you're on a diet to try to lose weight. The body thinks that you have been deployed to some war in the desert and there is no food, and the body slows down the metabolism to conserve the energy that you have stored in your body in the form of fat. So it's very counterproductive because you're trying to lose weight, you're doing exercise, you're eating less, but your metabolism slows down. Wow. And when you get off the diet, your metabolism stays low. It doesn't come back up. And so that is kind of the difficulty, but it's because we were created as a defense mechanism. There's a defense mechanism for famine, for malnutrition. And of course now in our developed world, we don't have famine and malnutrition.
Now, so let's get into the consequences of obesity. I think it's important to talk about this. So there's so many ways being obese can affect your health, and we have a list of examples I want to go through with Dr. Gonzalez. First one being high blood pressure. Oh my gosh, so many people suffer from this.
Correct. So, you are obese, you go to the doctor's office, they find your blood pressure is high, the doctor will tell you, cut out the salt, a little bit of weight loss, a little bit of exercise, try to get the blood pressure down. As your weight goes up, your blood pressure goes up. As your weight comes down, your blood pressure goes down. And so high blood pressure is directly linked with obesity. Next, we see diabetes, very commonly, type 2 diabetes, which is what we call adult onset or non-insulin, though a lot of type 2 diabetics have to be on insulin, is related to obesity. The more obese you are, the more likely your diabetes.
I want to move on really quick, doctor. Sleep apnea and cancer.
Yes,
really?
Sleep apnea, because of the obesity in your chest and in your neck, that can obstruct your breathing, and that causes sleep apnea. Sleep apnea is not breathing when you're sleeping. And then cancers. We know that breast cancer, endometrial cancer, uterine cancer are more common in the women who are obese, and then esophageal colon cancer more common in the men who are obese.
To watch more of that interview where Dr. Gonzalez talks about candidates for weight loss surgery, you can find the video on the Health Channel app.